2, 1. Okay, let's move on. And Dr. Cole, more and more talk about baseball, and it's very interesting. You guys have a hand in this as well. We're going to bring on Dr. Kathy Weber, primary care sports medicine specialist at Midwest Orthopaedics at Rush, one of your partners who works with you with the Bulls and White Sox and DePaul University. And you both also work, I understand, with the Chicago Dogs Independent Baseball League. And they're talking about trying to begin a shortened spring training as early as July 5th. You've been the head team physician for the last 3 years for the Chicago Dogs, based out of Rosemont. They've got a beautiful stadium, a lot of fun at those games. But tell us a little bit, Dr. Cole, and then we'll bring on Dr. Kathy Weber, about the process to keep the players, the staff safe, and everyone that might get involved with bringing baseball back at that level.
Steve, it's interesting because, in the beginning of all this, there's no way we would have even discussed, sports, putting an athlete in the same presence of another athlete, and let alone any of the economic burden that, the pandemic has imposed. As we've come to understand things, you saw how there's this evolution of, we seem to be in reasonable control of the medical system. We understand what the shortcomings are. We know what surges look like, at least to date. And we knew about supplies and so forth. And then we sort of evolve into the next phase is, let's talk about the possibility of putting athletes in the same place at the same time and how we can manage risk. And actually, consider doing competitive sports. So truth be told, now that testing is becoming a less contentious topic, and it seems to be available, and that has always been envisioned to be a part of the process, and not just single testing, but to do repeat testing, and then basically sort of being able to kind of isolate people so that they have a low risk of exposure. So with independent baseball, there's 6 of the 12 teams locally that are going to are planning on starting at July 5th or so. They're going to do an abbreviated spring training. We're doing the physicals this coming Wednesday. There's about 25 to 30 players for the Chicago Dogs, and the plan will be to test them, to have them in relative isolation, to retest them, and the same will happen with the staff. And then because Illinois still has an executive order to limit the number of people in any single location, they're going to play their games, considered home and away games, all at once, basically, in Milwaukee for the comparable team in Milwaukee. And I think there's 6 teams that have agreed to do it. And they will play a 60 series, a series of 60 games between July and September. That's the plan anyway. And they have a very stringent protocol in place. And amazingly, they're even contemplating the possibility of having fans, where fans would be have their temperature checks at the gate. They'd be wearing masks. They would be seating them in a socially responsible way in terms of social distancing, and it would be outside, obviously. So it's a pretty well laid out plan that I think is fairly innovative. Obviously, this is uncharted territory. We've only seen some European sports take off now to do this, so they'll be looked at very carefully as hopefully a responsible model to keep people safe, yet provide the opportunity to watch sports.
Wow, and a lot of this falls in the hands of Dr. Kathy Weber, again, one of your partners at Midwest Orthopaedics at Rush, who's our guest this morning, primary care sports specialist. And Dr. Weber, thanks for joining us on Sports Medicine Weekly. What kind of challenges does this present? Pretty unprecedented, correct?
Yes. I mean, hopefully we'll never see this again in our lifetime.
Absolutely. And Dr. Weber, when did they start talking about this, with the Chicago Dogs? I know you've been talking with the White Sox, obviously, you and Dr. Cole and Dr. Nick Verma, the head team physician for Midwest Orthopaedics at Rush, handling the White Sox. But, regarding baseball, is this just a constant everyday discussion with the teams of how to move forward once they get the nod to play again?
This has been a process really ever since the start of the pandemic and when spring training was ended. So there's been lots of discussions, lots of conference calls, including, Major League Baseball team physicians, trainers, infectious disease experts, looking at the problem at hand and how do we, best address it, because ultimately we want to have the safety of all our staff and players if and when baseball gets started.
Kathy, I laid out some things that the Chicago Dogs are doing, and I know you have not been involved directly with that, but is it suffice it to say they are well ahead and much more public about it than Major League Baseball has been?
I think that it's been an evolving conversation with Major League Baseball and the Players Association, and team physicians, trainers, et cetera. I can tell you that there's been lots of hours put into the whole process. They have been, I think, less vocal about the process, but I think that behind the scenes, appropriate actions are being taken, and with again, ultimately, starting with a successful, safe program for all that are involved.
Sort of generically speaking, would you agree that testing is, no matter what we do with professional sports, that it will really rely upon, in the absence of treatment, the absence of herd immunity, the absence of a vaccine, you and I are really going to depend upon the ability to test liberally and at the same time keep people, out of harm's way to get potentially sort of having viral transmission from one person to the other. But really the crux of this is testing. Is that fair to say?
I would agree that testing is definitely going to be a big part of the monitoring and also, looking at the safety factors. But all the other things that are important too is, the responsibility of players and staff, and trying to do, the appropriate things to keep themselves safe and their families. So it's a combination of, yes, testing is going to be, a very important part of this, but it's also going to be, an important part of the responsibility of player and staff to make sure that they're, doing all the proper safety precautions that are necessary and put into place during this process.
Yeah, I mean, having read a number of the different protocols from different organizations, it's going to be no small task. I mean, even from a psychological perspective, what people have to do to remain safe, and then the trust factor, and even the isolation aspect, it's not trivial. I mean, our athletes are young and have variable systems around them, and like everyone, and I think that's going to be an interesting side of it, is how the psychological impact of what it's going to take to actually play the sport. I know that people sometimes are not sympathetic to that because of the money that's involved, but I think people have to remember that these are young people. They're the age of a lot of our kids, actually, and there's a lot that's going to be asked of people, in addition to the coaching staff, some of whom are at risk, and the training staff, and you and me and everyone else. I think there's a lot that goes on that the public, yet doesn't know. That's not, and there's a lot that we don't know. So this just continues to be an evolving discussion for sure.
Right. I mean, I definitely agree. I mean, the behind-the-scenes conversations, time and effort that everyone has put into trying to lay out a plan that we think is going to be effective has been enormous. And the public doesn't realize, that this isn't a simple few conversations. It's taken a lot to get to the point that we're at. And it is going to be, everybody's going to be a part of it, and everybody's going to have a sense of their own self responsibility and really respect others while we go through this process. And the public needs to be aware that there is going to be some challenges going forward for players. And I think a lot of people are concerned in general in the public about the coronavirus, but athletes getting back to their sport, there's got to be a little bit of anxiety about that. But ultimately, with the plans that have been put in place, we want everybody to feel comfortable and feel that everything that's possibly could be done is being done, and really trying to, again, look after the safety and health of all of our players, staff, and even fans. We want everybody to be healthy through this process.
We're visiting with Dr. Kathy Weber, primary care sports medicine specialist of Midwest Orthopaedics at Rush, along with Dr. Brian Cole. I'm Steve Cashel. We're talking about the Chicago Dogs Independent Baseball League and possibly getting together as early as July 5th up in Milwaukee to to play baseball again and go through a shortened spring training. Dr. Weber, I wanted to ask you, kind of in your role now, we've been through COVID now for a number of months. Take the listeners through a typical testing process. Has that changed at all in the past number of months?
Well, I mean, it has changed because, one, we have more tests available. So in the early days of the COVID, testing was not easily available. And so people were not being tested, even if we thought that they had it, because there just weren't enough tests. We would quarantine people and assume that they had it. Now with the more readily available testing, that clearly has kind of changed the game and allowed people to be tested quicker. There's been a lot of research in looking at antibody testing, there's saliva testing studies going on now. So there's been a lot of progress in the science of testing, which is going to help the community as a whole. It definitely will help with testing athletes, et cetera. But the reality is, the testing will need to be monitored probably on a fairly common schedule to make sure, because as you and I know, that you can get tested one day and be negative and the next day be positive. And so that's the hard part about, that quarantine time or the time of exposure. And so testing is helpful. We have more plentiful testing and testing sites. And so the challenge of that has decreased, but there's still the challenge of, when do you test? How often do you test? How do antibodies play into this, and what tests are really reliable and valid, and how many false negative tests. And so there's still a lot that we need to learn about testing, but where we're at today from even, 3 months ago is, leaps and bounds. And as each day passes, we learn more. But this is a complicated virus, and it's obviously killed 120,000 people in this country. So we respect it. We respect the virus, and we need to be sure that we're doing all that we can to protect the community as a whole, not just professional baseball players, but the whole community that we exist in.
Well, we've been looking forward to baseball, and once again, a great announcement out of Rosemont just last week, the American Association of Independent Professional Baseball providing an optimism for people wanting baseball to return. The league will begin play July 3rd with a 60-game season, and it looks like the Chicago Dogs are going to utilize the Milwaukee Milkmen Stadium as their home ballpark until capacity restrictions for outdoor events have relaxed, allowing the Chicago Dogs to return to Impact Field in Rosemont. And again, they're talking about a season from July 3rd to September 10th with a championship series. And so it's going to be very, very interesting. The Dogs paired with 5 other teams, all from the Midwest. And looks like professional baseball games will be played on that level in the Independent Baseball League. So, Dr. Weber, thanks so much for joining us. Great information. And let's hope we get baseball back from all levels, especially the major leagues coming up soon.
Thanks for having me, and have a good day.
Thank you. Dr. Kathy Weber, again, primary care sports medicine specialist, Midwest Orthopaedics at Rush, and one of the team doctors for the Bulls, White Sox, and the Chicago Dogs minor league baseball team. I'm Steve Cashel with Dr. Brian Cole. Coming up next on Sports Medicine Weekly, our staple of the show, our Ask the Doctor segment. So stay with us. We'll tell you how you can get involved. Got some questions for Dr. Cole when we return. You're listening to Sports Medicine Weekly, only on
6-7.